Hi, I'm Dr. Melita Tate with Grassroots Healthcare, and I'm here today to talk about the negative impacts of sugar on the body. So we all know that back in the 1980s, or if you were in the 1980s with me, you'll remember that the American Heart Association, the American Medical Association, and the government department, the U.S. Department of Agriculture, all told us we needed to get fat out of our diets, and that was going to help heart disease. Well, what we saw was a skyrocket of diabetes and heart disease, and today we know that that wasn't really the culprit. It wasn't the fats, but the sugars. And so as a medical doctor, I've gotten to see quite a few of my patients drop their cholesterol levels like a stone just by eliminating sugar and processed food from the body. And we have an obesity epidemic, especially here in Oklahoma. We also see this epidemic reaching down even into our 6-month-olds. So they've begun to put high fructose corn syrup and fructose and other forms of sugar. They have names, all different names for it, not just in Coca-Cola, which is, one of our nemesis, but also in all kinds of processed foods, candies, cakes, but not just things you would consider sweet. It's in your processed food, it's in your breads, it's in everything. And so we as Americans have increased our consumption of sugar over these past several decades astronomically, and also heart disease, diabetes, obesity, all these things have gone through the roof. So it's obvious what the smoking gun is here, and it's sugar. I used to tell my little kids that I had whenever they were younger, I'd be like, you guys, when you want a soda from the convenience store, I'm just gonna have you light up a cigarette because it's just as bad for you. They were like, Mama, no. But really, sugar has a lot of negative effects, not just the typical, cavities or the fact that you're gonna gain weight, but also has effect on your inflammation, which leads to aging. It leads to increased heart disease risk. It increases decreases our sensitivity to insulin. So we have insulin resistance with that. And along with that comes the hunger satiety hormone leptin, which will not respond whenever the insulin is so high that they can't detect any kind of change in your low versus high levels of insulin. So we don't feel that need for satiety. So the definition of any drug is something that can get into your bloodstream quickly, cross the blood-brain barrier, and give you pleasurable effects, and that is in supraphysiologic levels. And so sugar fits that category, and it's had, very profound effects on our health, both as a state in Oklahoma, as a country, and now we're starting to see some of those effects even in other countries. So we here at Grassroots Healthcare promote a sugar detox. We have a 21-day sugar detox, and a lot of our patients have found success with being able to get back their control of their cravings, their moods. One of my favorite stories about sugar, the sugar detox, is we had put a couple of patients on it several years ago, and they came in at separate times to follow up with me at the end of their sugar detox. And one of my patients had gained a bunch of weight because, he had gotten a divorce, and he said he had been doing everything he could to lose the weight. It had always worked for him before, and his weight just wasn't coming off. So we put him on the sugar detox along with a young mother who was also in for, she thought she had ADHD. She said that she would go into a room. She just had a baby. We really couldn't put her on any medications anyway. And she would go into a room, felt like she had not remembered why she was in the room. She couldn't help her girls with their homework, lots of things. And so we really couldn't treat her. So we tried a sugar detox, and she went off of some other things as well. So they both followed up with me, and she's like, I don't have trouble concentrating. I can concentrate better than ever. I'm not depressed anymore. And so she left the office that day without a prescription and just feeling so much better just from a lifestyle intervention and a dietary change. And the same day, the fellow came back in, and he's like, Dr. Tate, he said, this is amazing. He said, I did not expect, because he had lost weight, but he said, I did not expect my depression to go away. So the inflammation that sugar causes and the dysbiosis in our gut health, those gut bacteria, they produce the majority of our serotonin. And so sugar can also play a huge role on our mood and our depression, our attitude. So my goal for my patients is to give them back control of what they eat. And so we encourage you, if you're interested, we're gonna put a link to the sugar detox down there. Let us know if you have questions. We'd love to be supportive and helpful. Thank you.